community. In addition to IDPH Director Dr. Ngozi Ezike, I'm joined here by Julie Pride, Administrator of the Champaign-Urbana Public Health Department, Sam Toya, the President of the Illinois Restaurant Association, Dr. Tifu Shen, Deputy Director of IDPH's Office of Policy Planning and Statistics. He's also an MD, PhD, and a former CDC Epidemic Intelligence Service officer who has been a senior epidemiologist at IDPH for over 20 years. Before I hand it over to IDPH Director Dr. Ngozi Ezike for our medical update, I want to share some terrific news with you that will make a big difference for the 1.8 million Illinoisans who receive SNAP food assistance benefits. To keep more families safe and healthy, my administration sought to expand the ways in which SNAP recipients can acquire groceries to include online purchasing. As of this morning, Illinois' plan to enable SNAP recipients to purchase groceries online has been approved by the federal government already. Walmart and Amazon have agreed to accept online orders from Illinois' SNAP users, and we encourage any interested grocery retailer to use this program. This access will begin June 2nd without any additional legwork on the user's end. Link customers will receive an alert when they can use their card online. And the best part is that in addition to helping families shop a little easier and safer during this pandemic, this is a permanent new feature of the SNAP landscape in Illinois that will support our residents for many years to come. And now I'd like to turn it over to Dr. Ezike for today's medical update.
Thank you, Governor, and good afternoon, everyone. I want to start off with some additional good news. We are seeing a decrease in the numbers of people hospitalized, the numbers of people in the ICU, and the numbers of individuals on the ventilators associated with COVID-19. As of last night, 3,914 individuals were reported to be hospitalized with COVID-19 across the state. Of those, 1,005 were in the ICU, and 554 were on ventilators. This is the lowest number since we were capturing these numbers that we have had for COVID patients in the hospital. Over the last 24 hours, 2,388 additional individuals have been reported to have COVID-19. We now have over 100,000 total confirmed cases, and unfortunately that includes 147 additional people who were reported to have lost their battle with COVID-19 over the last 24 hours. And again, our total for the state of Illinois is 4,525 deaths. A total of 642,713 tests have been run statewide, with 21,029 tests being reported in the last 24 hours. I really want to touch on briefly the type of test that's being used at the state-run community-based testing site. At these sites, like the one that just opened up in Champaign, a simple nasal swab is used. The swab looks like a long Q-tip, and the person inserts it in the nose up to about the bridge of the nose, turns it 5 times, withdraws it, and then repeats the same process on the other side. This is not the same as what's called the nasopharyngeal swab, or NP swab, which requires a trained medical professional to go further back into the back of the nasal cavity. Despite these two different methods, both of these methods or types of testing can be used and have similar sensitivity. And as someone who has received the nasopharyngeal swab, you should be happy to have the nasal swab. There has been some misinformation about these testing sites and the type of test being used, so I just wanted to clear up any confusion. It's important that we're dealing with the right information and the correct facts. I also want to highlight, I know we have many guests with us today, but I'm also flanked by the best of the best when you think of public health. We have, and you'll hear from them later, Julie Pride and Dr. Tifu Shen, who represent over 50 years of service to public health departments, including taking the Champaign Public Health Department to the next level, and a world-renowned cancer registry database created by Dr. Tifu Shen. We are in the midst of an unprecedented public health emergency, and the public health teams that have fought for years for additional resources to ensure that all of the public health functions could be met are now continuing to do more with less. But that more in these times is a Herculean more that has spanned the last 5 months with no clear end to the pandemic in sight. I'm grateful for both our state health department staff and our local health department staff who show up every day or work virtually every day, all through the week, all times of the night. They're spent and they might be tired, but they're continuing to offer what they have in order to save lives. This is happening all across the state. Whenever I talk to state or local health department officials, I try to remember to thank them for their incredible service. And so I am encouraging all the people of Illinois to show their love for their local health departments. We have 97 different certified health departments throughout the state, and they're all doing God's work right now. Some departments may have only 5 members that make up the team. Others may have hundreds, but they are all facing immense pressure as they battle this pandemic. Please let this serve as a call to action to identify your local health department and send a card of thanks or some other appreciation gesture to the public health team that's working day and night on your behalf. I thank Governor Pritzker for showing his love and support for Team IDPH. He's offered regular calls to support the team and offered other generous gestures while we took on this COVID-19 response. Team IDPH and the local health departments are the governor's unwavering partner as we serve every corner of Illinois. Thank you for your support, and please don't forget to show some love to your local health department. And with that, I will summarize comments in Spanish. Buenos tardes. Tengo buenas noticias. El número de personas hospitalizadas está bajando. Reportó 3,914 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 105 pacientes estaban en la unidad de cuidados intensivos y 554 pacientes estaban en ventiladores. En las últimas 24 horas se reportan 2,388 nuevos casos con COVID-19. Ahora tenemos 100,418 casos totales confirmados en Illinois. Desafortunadamente, esto incluye 147 personas adicionales con COVID-19 que han perdido la vida, para un total de 4,525 muertes. 21,029 pruebas hechas fueron reportadas en las últimas 24 horas. Quiero mencionar brevemente el tipo de prueba que se está utilizando en los sitios de prueba basados en la comunidad administrados por el Estado. En estos sitios, como el que acaba de abrir en Champaign, se usa un hisopo nasal simple que parece como un Q-tip y está aprobado por el CDC. Hemos oído mala información sobre esta manera de prueba en nuestro sitio. Quiero que sepan la verdad. Hay varias maneras de hacer una prueba de COVID-19 y todas son efectivas. Estamos en medio de una emergencia de salud pública sin precedentes y los equipos de salud pública han luchado por años para recursos adicionales en sus comunidades. Ahora continúan haciendo más con menos, pero ese más es un más hercúleo que han hecho los últimos 5 meses sin un final claro a la vista de esta pandemia. Estoy agradecida al personal del Departamento de Salud locales que se presentan todos los días de la semana y en todo momento de la noche y nos ofrecen lo poco que quedaba en su tanque para salvar vidas. Pido a la gente de Illinois que muestran su amor por su Departamento de Salud local. Tenemos 97 departamentos de salud locales diferentes en todo el estado que están haciendo el trabajo de Dios en este momento. Algunos departamentos tienen 5 empleados y otros pueden tener cientos de empleados, pero todos enfrentan una inmensa presión mientras luchan contra esta pandemia. Esta es una llamada de acción para identificar su departamento de salud local y enviar una tarjeta de agradecimiento al equipo de salud pública que trabaja día y noche en su nombre. Gracias para su apoyo. And with that, I will turn it back over to Governor Pritzker.
Thank you very much, Doctor, and thank you for the work that you do at IDPH, and to all of your colleagues, too, who really have been working overtime to get it right for the people of Illinois. In the midst of this coronavirus pandemic, all Illinoisans have been forced to carry out a very difficult task of fighting against an enemy that you can't see until you or your loved ones fall sick. Slowing it down has required us to stay home and to stay apart for 2 months already. And the virus has brought with it an enormous financial toll on workers and families. Somehow you have found the strength to do what's been required to fight the fight. And you have done these things with exceptional grace and compassion for your fellow Illinoisans. You are slowing the spread. You're bending the curve, keeping our hospital capacity from being overwhelmed. All around the state, in our streets and our grocery stores, you see people wearing face coverings, knowing they are protecting each other, doing the right thing for their communities and their loved ones. And because of your perseverance, we have reduced our rate of spread tremendously in every region of the state since even just the beginning of May. We have seen our positivity rate drop. Our current 7-day average is 10.3%. The need for hospital beds and ICU beds and ventilators has decreased. We are building up our ability to test and contact trace, which allows us to slow and eventually stop new outbreaks before they start. When I introduced our reopening framework, I said that we can and we will make our Restore Illinois plan smarter as we move forward. That is as true today as it was a few weeks ago. We are by no means out of the woods. The virus is still causing sickness and taking lives, but directionally things are getting better. And because of these advances, we are able to make some modifications to allow more activity during phase 3 of our reopening plan, Restore Illinois, which all regions of Illinois appear to be on track to reach by the end of May. Every day from the beginning of this pandemic, my team and I have been in close consultation with public health experts, both inside and outside government, to discuss when and how we can return different elements of everyday life for Illinoisans. Our mission has always been to get people back to work, get students back to school, and return to as much normalcy as possible without jeopardizing the health and safety of Illinoisans. To do so, we've listened and learned and tracked the science and the data every day to ensure that we're taking the best possible approach. Based on that work, the experts have indicated that we can build onto our plan to bring back more activities faster, as long as Illinoisans continue to do as we have been doing, adhering to precautions and safety measures to keep each other safe. I want to begin by talking about bars and restaurants, many of which are the beloved institutions that make the cities and towns of Illinois so special. The local diner, the corner bar with friendly servers and bartenders and owners known to the whole community. Tragically, they were some of the first and hardest hit by this pandemic. To date, my administration has delivered tens of millions of dollars of assistance to small businesses, including to bars and restaurants. The industry employs hundreds of thousands of people in every corner of our state, and financial assistance isn't enough. So it's been important to me to reopen them, but only if it can be done in a way that keeps its employees and customers safe. Given what is known about how this virus spreads in closed spaces, our public health experts made the decision early on that bars and restaurants should not open their regular indoor food service, and that's still the case until we reach phase 4. That has turned out to be a good public health decision, but we have to put public health first. And that means the safety and peace of mind of consumers and employees alike. But the epidemiologists now believe that summer offers us an opportunity if proper precautions are taken by businesses and their patrons. So after listening to and working with restaurant industry representatives together with our epidemiologists, today I'm announcing an additional option for bars and restaurants interested in resuming operations earlier. Opening for outdoor seating when phase 3 begins, likely for everyone just 9 days from now. With the right restrictions, tables 6 feet apart and away from the sidewalks, masks and distancing measures for staff, and other precautions, the experts believe that these services can open at a risk comparable to other outdoor activities and give our hospitality industry a much-needed boost as they work to keep their businesses on their feet during this terrible crisis. On that note, I want to encourage municipalities and mayors who are interested in helping restaurants expand their outdoor seating options to do whatever is in their power and best fits their communities to help these restaurants. We've seen an incredible outpouring of creativity from every corner of the state throughout this crisis, and I have no doubt that Illinoisans will continue that spirit as we pave our way forward. Looking ahead, I also want to elaborate on next steps for outdoor activities. As laid out in Restore Illinois, Phase 3 permits all gatherings, not just essential ones, of 10 people or fewer. That means if you want to go enjoy a picnic in the park or a walk with 9 other people, you can. Just remember to wear a mask or face covering when social distancing can't be maintained. With this new 10-person gathering limit, our restriction around outdoor activities in Phase 3 will see some changes. That means boating or camping with up to 10 people is welcome in boats that are an appropriate size to hold that number. Illinois is also allowing the reopening of indoor and outdoor tennis facilities with IDPH safety precautions and capacity limits. As for golfers, in Phase 3, courses can allow foursomes out on the same tee times. Carts will also be permitted with only 1 person per cart or 1 immediate household per cart. With significant work to determine staffing and safety measures, all state parks will reopen on May 29th. All concessions will reopen as well under guidelines set for our retail and food service businesses in Phase 3. I know how important our state parks are to communities across our state, and the staff and leadership of our Department of Natural Resources are looking forward to welcoming Illinoisans back. Additionally, in the coming days, we will be providing guidance on how other outdoor recreational businesses, such as driving ranges, outdoor shooting ranges, and paintball courses, can safely open their doors in Phase 3. And on the topic of the days ahead, I want to remind everyone of the other businesses and activities already laid out for Phase 3. In Phase 3, personal care services like nail salons, beauty salons, spas, tattoo shops, hair braiders, and barber shops can open with IDPH safety precautions and capacity limits. For health clubs, gyms, and fitness studios, one-on-one personal training in indoor facilities and outdoor fitness classes of up to 10 people are allowed with precautions adhered to. And all retail stores, basically any store that wasn't already open as an essential business, can choose to open their doors to an in-person shopping with IDPH safety precautions and capacity limits in place. Of course, there's a whole lot of life outside these arenas, and I know people will have questions on the specifics of these announcements, as well as on topics outside of what I've outlined today. In the coming days, we'll be releasing formal industry-specific guidance developed in consultation with business owners and employees, particularly around workplaces and childcare. IDPH and my office have also received many proposals from churches and religious organizations on how they could operate safely in larger gatherings, including outdoor and drive-in settings, and we are working with them to help offer additional flexibility. Finally, I want to be clear that local governments have every right to establish stricter guidance to local businesses or for local recreation in any of these areas if they believe it would be in the best interests of the people that they represent. I want to offer just a note of concern that I hope everyone will take to heart. The virus has not gone away. Other states that have thrown out restrictions and decided to just go without regulation are seeing rising cases and beginning to see rising hospitalizations. Here in Illinois, we have followed the science and we're succeeding, but we can't let up now. We've come too far and we've made so much progress because we've kept social distance, worn face coverings in public, washed our hands frequently, and taken care of our most vulnerable to the best of our ability. We must persevere. Illinois, this road is a long one, and I know that it's hard to see the hate on display by recent protesters who ignore that we've lost thousands of Illinoisans to this virus. Thousands more are fighting for their lives in our hospitals, and our medical professions and our medical professionals are heroically working round the clock to save lives. Perspective is often difficult to find from up close, but the way the vast majority of the people of the state have come together in this moment is truly incredible. I have never been more proud of Illinois. Thank you, and now I'm proud to introduce a veteran public health administrator with decades of experience in infectious disease prevention, Julie Pride, administrator of the Champaign-Urbana Public Health Department. Julie.
Hi, good afternoon. I'm Julie Pride, Administrator for Champaign-Urbana Public Health District. Thank you, Governor Pritzker, for the opportunity to be here today for this welcome announcement on our path to safely restore Illinois and for always leading with science and public health. I also want to thank Dr. Ezike for always listening to local public health departments and for valuing the input that we bring from our local communities all across Illinois. In Champaign County, as in all over Illinois, we are ready to safely transition into Phase 3 of the Restore Illinois plan. The outdoor restaurant reopening carefully weighs public health concerns with the desire to open up the economy as well. Our local community partners are combining their entrepreneurial creativity with public health infection control guidance to craft innovative solutions for the challenging times that we find ourselves. New partnerships are being formed and old partnerships are being strengthened. There will likely be some changes made to how we do things as a society long after the pandemic is over, not because they are required, but because they work better. Innovations made to accommodate social distancing in outdoor dining, such as reservations and closing streets to expand seating, may become the new way of life in vibrant downtown districts even after the pandemic ends. I have always been very impressed by the generosity and kindness shown by the restaurant industry. They are constant contributors to fundraisers, local sports teams, and charities. They not only support each other, but they are often among the first to offer help in any type of emergency. On the very day that the governor announced the closure of schools, to help flatten the curve, many restaurants around the state announced free lunches for all school-aged children. Now is the time that we all need to give back to our restaurants and all the businesses that are opening in Phase 3. They need everyone to follow the guidance and the new procedures that are being put into place. They need everyone to be patient with their staff and other patrons as we all adjust to the new normal. And they need us to respect their health by wearing face coverings when it's required. Let's all move into Phase 3 together, and let's do it safely and with intention. Thank you. And now I would like to introduce Sam Toya from the Illinois Restaurant Association.
Thank you, Julie, and thank you, Governor Pritzker. I appreciate the opportunity to be here today. I'd like to first begin by thanking the hospitality industry for their resilience, their voice, and their commitment to community. Every day, we learn about operators and chefs throughout the state feeding medical workers, first responders, their industry peers, and the community at large. I'm astonished by the generosity and the spirit we see from our industry during this time of crisis, even when their own future hangs in balance. Our restaurant industry, the largest private sector employer here in the state of Illinois, has been hemorrhaging for the past 9 weeks. More than half our restaurants have closed and sales are down 70 to 80%, and more than 321,000 of the 594,000 people that work in the restaurant food industry in bars have been laid off. By the most conservative estimate, statistics show that 20 to 25% of restaurants will close their doors for good as a result of COVID-19. Representing nearly 26,000 restaurant owners statewide have voiced their concerns to the IRA about the dire circumstances they face and the future of their business. I am pleased to say that Governor Pritzker and his team are listening. Today's announcement provides a glimmer of light at the end of this very dark tunnel. The governor's action to allow for expanded outdoor dining options will be benefit to many at a time when every dollar counts. We recognize that this action will not provide a solution for every operator, but it's a step in the right direction for restaurant, diners, communities around the state, from Springfield to Carbondale to Rockford to Champaign to Chicago. The outdoor dining strategies supported by this administration extend a lifeline, helping bring back jobs and offering diners the hospitality experience they've been missing, all the while maintaining necessary public health and safety measures. Throughout and before this crisis, restaurants' top priority has been the health and public safety of their guests and team members. We will be looking to local municipalities, their leaders like Mayor Lightfoot of Chicago, Mayor Langford, of Springfield, to discover creative ways to make our outdoor dining work for communities while maintaining high standards of safety to which they are accustomed, and establishing further measures to protect public well-being. Let's close down streets. Let's expand sidewalk cafes. Let's use parking lots and public ways. Let's show the world how innovative Illinois can be. Again, while we recognize this solution won't apply to all operators, it's a step in the right direction and presents an opportunity for Illinois to demonstrate our leadership and innovation. The IRA appreciates the open dialogue and communication from Governor Pritzker and his team. As I always say, communication and education are truly the key to success, and Governor Pritzker and his team are always communicating education, so I want to thank them for that. We will continue to collaborate with all stakeholders, small business, elected officials, public health experts, to work through this crisis, flatten the curve, and revive our economy. We look forward to getting our restaurants open for business. Never underestimate our restaurants' ability to rise to a challenge. We will open and we reopen safely. And again, go out, get online, make reservations to these outdoor cafes here in the state of Illinois, throughout our towns, municipalities, and cities. So we look forward to working with the governor and his team, and we're very happy about this next phase. And like I say, all restaurateurs care about the safety and health of their customers and team members at all times. So, thank you.
Thank you, Sam. I want to address, I want to address my administration's emergency rule authorizing an additional compliance mechanism relating to our stay-at-home order, assisting local law enforcement and state's attorneys in their work to keep people safe. The majority of states, from our Midwest colleagues like Ohio and Wisconsin to other Republican-led states like Georgia and Florida, have or have had a broader range of enforcement mechanisms relating to their stay-at-home orders. This temporary emergency rule brought Illinois in line with this national practice, giving local officials more flexibility in their ability to enforce this order with a simple citation. That flexibility is the critical piece of this. The state already has enforcement authority through an IDPH closure order or the revocation of a business license. But those tools are harsher measures than anybody, including me, is interested in pursuing. A business that chooses not to follow the rules can recover from a fine. It is much more expensive to deal with being stripped of a license or forced to close. The General Assembly has now returned to its operations for the first time since March, and in consultation with leadership in the State House, my administration has decided to withdraw this rule in order to pursue legislation with the same intended mechanism in a phased manner, in line with the Restore Illinois plan. Enacting this measure through legislation will allow us to have these tools throughout the Restore Illinois plan versus an emergency rule that would be withdrawn and rewritten at the start of Phase 3 and then Phase 4. I'm here today with Illinois State Police Director Brendan Kelly, as well as Leader Bill Cunningham, who is sponsoring this legislation. I urge the General Assembly to take up and pass this legislation this week. Given the importance of what we are trying to do here, we will look to file an additional rule if legislation does not occur. Our only goal here is one that we all share: prioritizing public health while reducing the harm that bad actors can cause the broader small business community, so important to the strength of our economy. And with that, I'd like to turn it over first to Leader Cunningham.
Thank you, Governor, and thank you for your leadership throughout this crisis. My name is State Senator Bill Cunningham. I'm the state senator for the 18th district that covers the southwest side of Chicago and several southwest suburbs. I want to focus on a point that the governor just made, that being that the legislature is back in session this week. As we all know, that has not been the case for several weeks. In the absence of the legislature, the governor and his administration, the various agencies in the administration, have had to promulgate emergency rules. Many of those rules are meant to be aligned with the governor's executive order related to staying safe during the coronavirus crisis. By virtue of the fact that we're here in town, we've talked with the governor, both the members of the Joint Committee on Administrative Rules, which I am the co-chairman of, and the leadership in both chambers, and we think it's appropriate that we deal with this problem through the regular legislative order, and that's what we're committed to do this week. I think I can speak for myself, and I believe a number of other legislators, that we agree with the intent of the Department of Public Health when it comes to enforcing the governor's stay-at-home order. We've had some disagreements about the exact process, but now we'll be able to delve into those things here in the legislature. That's the way the process is intended to work, and we're looking forward to working with the governor on developing, I think, a really important and sensible piece of legislation. And with that, I would ask the Director of the Illinois State Police, Brendan Kelly, to come to the podium. Thank you.
All the resources we have in the state to do this testing. So General Compton's here today to give us a little update on what he'll be doing on the testing side. General?
Thank you, Governor. Hey, good afternoon. I am glad to provide an update on what the Missouri National Guard is doing to assist in our COVID-19 response efforts and reopening the state. We continue to support the governor's Show Me Strong recovery plan and have almost 1,000 soldiers and airmen working alongside local and state partners. Guard men and women are conducting medical screenings at state buildings in Jefferson City, St. Louis, Kansas City, and Springfield as the state workforce returns. We continue supporting N95 mask decontamination at 13 collection and redistribution sites throughout the state, and there are many organizations signed up to use this program. Our Guard members continue to assist with meal distribution from multiple food banks and support the Department of Elementary and Secondary Education in the delivery of nutritious meals to our school-aged children. In conjunction with SEMA's Disaster Medical Assistance Team, we continue to support and operate the alternate care site in Florissant. Our civil support team is supporting state lab testing, and as the governor just mentioned, we are working closely with DHSS, OA, and many other state agencies to expand testing across the state to support the health and well-being of Missouri citizens and help open up the Missouri economy. We look forward to the efforts that the governor alluded to that will expand our testing in the very near future And as he mentioned, that we'll roll out more details starting tomorrow. In addition, we continue to provide augmentation and logistic support to our interagency teammates to support a timely, coordinated response. I appreciate the partnerships and the incredible teamwork we've enjoyed with our state and local agencies. Much has been accomplished, working together and taking care of each other as one team. Governor Parson, thanks for your leadership, along with the support of our great partners and great communities across the state. Businesses are opening, and citizens are able to return to work. Missouri is recovering. Thank you for calling on the Missouri National Guard to help. We are proud to be part of this team of teams. We're always ready, always there. Show me strong. Thank you very much.
Thank you, General. I don't think you need to say any more closing on what he just said on that. I just appreciate General Compton and more importantly, just how blessed we are in this state to have the men and women that wear the uniform and what they represent, because nobody represents the values of the military more than the people that reside in this state. I also would like to say that COVID-19 has taken a toll on Missourians in many ways, not just physically, but also mentally for many people. As I've said many times, mental health is just as important as physical health, especially during difficult times like these. While we might not all be affected in the same way, this crisis has affected everyone, and we must remember to personally take care of ourselves physically and mentally. Today, Director Stringer's here with us to give an update on what his department's doing, but I want to say to the director and the employees at the mental health department for what they did during this time. You know, a lot of state employees, some state employees had the opportunity to stay home and be able to work from home, and we made that situation where they could do that. But there was hundreds upon hundreds of thousands of state employees in the mental health side of it that had to come to work every day and take care of people that couldn't take care of themselves, and had to put their fears aside during this whole time and still maintain to go to work and take care of people that need to be taken care of. And a lot of times it seems like those kind of people that I'm talking about is a little bit out of sight, out of mind for a lot of people. But it wasn't for those employees, because they stayed with it every day, day in, and they never missed a shift, they never missed a time, and they provided those services. So, Dr. Stringer, I want to thank you. I want to thank your department for what actions you took during this time. Dr. Stringer?
Thank you, Governor, and thank you for those kind words. I'd like to start by expressing my sincere condolences to the families and friends that have lost loved ones to this virus. I also want to again thank the many Department of Mental Health staff that, as the Governor says, continues to perform spectacularly during this crisis. This includes dedicated men and women who work on our state psychiatric hospitals, in our rehabilitation centers, in our state-operated community programs. I also need to acknowledge my department's contracted community providers of treatment, prevention, recovery, and rehabilitation services. I cannot tell you how much we appreciate your ongoing commitment to serving some of the state's most vulnerable citizens, especially during this most difficult time. So just a few updates this afternoon. First, I wanted to let you know that my department's Office of Disaster Services has developed what is called a behavioral health strike team that can quickly deploy specially trained individuals from our community mental health centers and the department's disaster team to work with an impacted region after a local emergency. This concept was piloted during the Branson duck boat tragedy. However, the outbreak of COVID-19 prompted us to fully activate and deploy this team for the first time. Strike team members worked in conjunction with the Air and Army Guard to assist families, individuals, and deployed service members in the St. Louis area. They assisted through crisis counseling, which involves teaching coping skills, managing stress, recognizing common reactions that people have after a disaster, and often just providing a listening ear. The deployment has been a success, and the team is standing by to provide further assistance. The second thing I wanted you to know is that my department has applied for a crisis counseling program grant. The Federal Emergency Management Agency, or FEMA, funds and oversees the crisis counseling program. to provide mental health support and training in presidentially declared major disaster areas. And this is the first time, by the way, that all 50 states have requested disaster declarations. The third and last thing I want you to be sure that you know is that the month of May is our nation's Mental Health Awareness Month. While the pandemic continues, its effects on mental and emotional health can be as serious as the effects on physical health. This is a stressful time, certainly due to fear of the virus, but also because of restricted activity, reduced contact with friends, family, and coworkers, loss of employment, which in itself can be devastating. And our nation's farmers are facing incredible challenges. It's understandable then to feel overwhelmed, stressed, and anxious. If you're feeling that way, of course, you're not alone. The good news is that help is available, and in new ways that you should know about. I mentioned before the Federal Disaster Distress Helpline, which is staffed 24/7 with specially trained mental health professionals who can listen and hopefully talk you through whatever you may be struggling with. They can also connect you with services here in Missouri if you need help beyond what they can provide. That helpline number is 800-985-5990. And of course, you can also search Google the Disaster Distress Helpline, and it'll tell you other ways to contact them if you'd like to. I'm also glad to tell you that thanks to the leadership of Governor Parson, Mo Health Director Todd Richardson, and leaders in my department, the strict rules about face-to-face counseling and other mental health services have been relaxed so that now people can get services in their own homes through platforms like FaceTime, Zoom, and even just phone calls. Our community mental health centers, substance use treatment providers, and providers of developmental disability services have found that this not only helps to prevent the spread of the virus, but also encourages engagement, protects privacy, eliminates transportation barriers, and gets and keeps people connected with potentially life-saving services. In conclusion, I'll just say this. We're in this together, and although we may never be the same, we will be forever stronger. Missouri strong. Thank you.
Thank you, Mark, and thanks for all the people that work over there at the department. One of the things Mark said when he was up here that I think is something that every day I get more proud of my directors and my commissioners that work under the administration of how much they work across their own lines to help one another out. He just mentioned in there when he was talking about how he had worked with the Guard, how he had worked with other agencies across state. That's one thing that I can tell you. All my directors are all willing to help each other when they need help, and I'm not sure a lot of states can say that, but I can tell you it's one thing I'm really proud of for what they do. So to wrap things up today, I'd like to share a few words of encouragement to Missouri's 2020 graduating seniors. Tomorrow, I have the very special opportunity to speak at my granddaughter's high school graduation, and I'm looking forward to that. It will be the first time that I've spoken at a high school graduation, and I guess it'll be the first time my granddaughter graduates also, so it'll be a good day for both of us on that. And as grandparents of a senior, Teresa and I understand the challenges that many seniors are going through right now. And I know this isn't what they thought their senior year would look like, but there is still a lot to celebrate. The year 2020 will not be remembered because of COVID-19 virus. The year 2020 will be remembered as a launching pad for the next generation of successful men and women like yourselves that will make this state and nation better off than ever before. Tonight, in honor of Missouri's 2020 seniors, Teresa and I are lighting up the governor's mansion for the first time in Missouri's history. And I will give credit to the First Lady. I think I get to just accompany her tonight, but this is really what she's put together, her and her team has for the mansion tonight. So starting at 8:20 tonight, for you that understand military time, 2020 is what that military will. On the 20th day, the mansion will be lit up for 20 minutes and 20 seconds. So on the 20th day of 2020, the mansion will be lit up 20 minutes and 20 seconds tonight. So we're looking forward to celebrate that. Again, we know this wasn't how you expected your senior year to end, but don't let this define your entire high school career. There will always be challenges in your life, but it's how we overcome these challenges that matters. We're cheering for all of you. Congrats to the class of 2020, and God bless, and thank you very much. Kelly, let's go to questions.
Hi, Doctor. Over here. Is there any special focus right now on the needs of young people? I'm thinking with schools having been out, obviously counselors have also been out or working remotely, so are there any challenges there that you're working on?
Certainly challenges, and we are working with young people. We've got a variety of not only treatment services available, but also prevention services. And prevention services that are designed for schools that we are adapting to the current situation. So absolutely keen interest in serving kids, and we'll continue to do that. Okay, thank you.
General, do you see the food distribution being expanded at all, maybe to more schools over the summer?
Yeah, it's a good question. Currently, we think we're about where we're going to be. I would suspect the demand, we're very hopeful, frankly, that the demand will reduce as our times get better in the coming weeks. But we'll always be ready with the need.
And to expand testing, how many more soldiers and airmen do you think would be needed to do that?
Yeah, well, we're fortunate. I briefed earlier, we have 1,000 on orders right now, and we're able to adjust our work effort across our lines of effort. So I don't know that we'll actually need to bring on that many more, if any, to complete the testing. But should we need more, they're available. Thank you.
Good afternoon, General. I know you said we'll know more tomorrow about how that testing mechanisms will work, but just in general terms, how can the Guard assist with testing? Is it delivering tests? Is it helping to set up a testing site?
Yeah, it's a great question, and you're correct in your two parts there. We can provide a myriad of things to support. You mentioned setting up test sites. We can actually support with the testing with some, in conjunction with medical support with the local agency. So transportation, logistics, setting up the site, data entry, and there'll be other things that come out through the rest of the staffing today, but we're excited to be a part of this. Thank you.
All right, thank you, General.
Thank you.
Let me give you a quick update on some things that I discussed with you earlier. We finished the testing at Affinia up in North St. Louis, and those zip codes were specifically picked because of the morbidity and mortality, sadly, we'd seen come out of there. And of 359 tests, 20 came back positive, and I know Mayor Cruson and Fred Eccles will be very interested in those results as we transition. About 15 are still pending, and some were inconclusive. And another number that we're very excited about is about half an hour ago, we got 2,040 more vials of remdesivir, and we will ship that out in the next 18 hours as soon as we get the word from the hospitals that need it and patients. And you heard the governor discuss the patient who was pregnant, who that very much changed her course, her clinicians felt. And so we're incredibly excited. That's our third course, and we got that a day ahead of time. So we will get that out today, and I think people have nationally recognized how quickly we've done that. And then the last number I'll give you is 9,254. That's the number of residents that live in the 50 nursing homes that have had one patient or one staff member in the last 14 days test positive. And we are actively going in and doing our boxed-in strategy for those 9,254 people as we speak. The governor said we couldn't do that, to use a military term, a force multiplier. Not only do we work well together in the cabinets, but we make each other better. And I know the other cabinet directors make me better. And so we're incredibly thankful for that. So I just want to give you that follow-up to things that we've been talking about. Any questions for Dr. Williams? Great, thank you.
Thank you. Just one follow-up, what somebody asked the general, I mean, how many troops he was going to have or how many he was going to deploy. I'm going to help him with that a little bit too, whatever we need. That's what we're going to deploy to meet those goals of that. So all the agencies know that pretty well, that the task is to go out, get the mission. We know what the mission is, and now it's time to execute the mission. So on that. So I'll be glad to take a few questions, or if I'll be glad to finish this up too. Won't matter either way to me on that.
Good afternoon, Governor. I don't know if you had a chance to see about the Missouri Chamber calling for a special session to address some concerns they have about the possibility of some of their members being sued as a result of COVID-19 related cases, what your thoughts were about that.
Yeah, well, you know, there's as we see other states and other things popping up on the legal challenge, it's quite apparent we're going to have to deal with the legal challenge that's going along with COVID-19. Look, whatever we need to do is calling the legislators back, but it won't be for one individual thing. If I call them back, we'll have some things in place that we need to do. There's still some issues that are very important to the state that need to be addressed, but we're going to be we're not going to let attorneys go out here and sue everybody because they was doing their jobs of COVID-19. So whatever it takes to kind of even that playing field, we'll plan on doing it in Missouri.
You mentioned yesterday you were meeting today with colleges, universities. How did that conversation go? Were they receptive to what you had to say? Yeah,
I met, we actually were online with most of the university and community college presidents this morning. We talked to, I think, a little over 500 superintendents across the state to pretty well tell them what to expect, what things look like in numbers right now. What we really told them that between now and July the 1st, there'll be more withholds coming up in the next probably week to 10 days to finish out 2020. But we're still looking at a hole of about 500 million to 700 million starting out July 1. So depending on what again, whatever comes down, if there's more portions of the CARE Act that comes down or whatever comes down, but right now we got to be prepared moving forward that we can meet that demand. And I wanted to make sure the superintendents across the state and the college and the universities know that we're going to have to kind of buckle down here a little bit for a while to get by, and if there's no other help coming. All right, thanks everybody for being here today. Thank you.